upper and lower. And for lower, I'm going to start with hamstring. And I'm going to do, for PNF, I will have them do hold relax. So for hamstring, I'll pick their leg up and then tell them to contract their quad for about 8 seconds. And then once they relax, I will push a little farther back because their hamstring should be stretched out more once you contract a different muscle. And manually to do that, you can either have them on the table and have them put their leg on top of the table and stretch that way, or you can sit on the ground the way I'm sitting and then stretch and hold their foot. For upper, I'm doing shoulder flexion, which is I would do a contract relax, so have them push against me, and once they're done relaxing, I will push back farther into flexion. And to manually do that, you can just have them put their arm back and have them stretch, and you can maybe have them doing it against the wall for farther flexion stretch. Okay, so explaining the differences between PNF and static stretching, I would say static stretching is a lot more where the athlete is doing it themselves, and then PNF is when a clinician does it, and it's more contraction. And I would say that a patient wouldn't mind either PNF or static stretching, but they are probably more likely to do static stretching because they do it on their own and they can add as much pressure as they want. I would say PNF is definitely more, what's the word I'm looking for? PNF is more beneficial because the clinician does it, and when the clinician does it, it adds a better stretch to a patient, and that's why I would say it's more effective. And because if an athlete was to do it, once they feel the stretch, they will stop right there. But once a clinician feels it, they will add a little bit more strength to it just to make sure flexibility increases.